Today we're going to cover the Queen's chronic knee pain issues. I was just reading a post on the internet that was saying that the Queen is going to have to give up her favorite pastime, which is riding horses, as a result of chronic knee pain. They were saying it was attributed to a lot of time walking and standing and in lines and parades and things that she'd done over her life. And this is absolutely the case. She probably is experiencing a lot of discomfort. However, I don't believe that she needs to stop riding her horses, especially if she enjoys it so much. It's actually really simple. Looking at what's going on in her body and her experience of chronic knee pain is a result of tension on the nerves in her knees. They were also saying she has sciatica issues, which is an impingement on a nerve coming out of her lower back, her sacrum. And there's a really simple solution to it. By looking at the nervous system and beginning to create comfort in the nervous system, you take pressure off of the nerves in the knees, as well as how she's standing and how it's contributing to what's going on with her sciatica in her lower back. I would also venture to say that there's probably some dehydration going on. And that's one of the protocols when I work with clients. We work together to establish those conditions to make the chronic knee pain go away, to make it the inevitability of it leaving the body. And that is one of the things. Actually, the video that I have on my website, thekneepainguru.com, goes over a simple rotation of the lower leg. And especially when someone is riding a horse, they need to keep their heels down. They need to keep the pressure into the stirrups. Well, what happens is because the horse's body is wider, the legs are going out, but the lower part of the legs has to keep tight to the horse's body while you're pushing down, while the tension is going down into the stirrups. So what happens is this creates tension in the pelvis and a different tension pattern in the knees that actually causes the hips and the knees to fight themselves. This causes the wearing in the joint that you'll see that ends up in looking like arthritis, ends up looking in chronic knee pain, degenerative joint issues, bone-on-bone type of scenarios. And also from the report that I was reading, they were saying she had bone chips, issues as far as the meniscus wearing away that they've taken out. She's had arthroscopic surgery to take out the chips in her knee. And of course, this is a result of the bones and how they're rubbing against the cartilage and the meniscus in the knee joint. So by creating comfort, taking the pressure off of the nerves, you create the space in the knee joint so one, the nerves are not interfered with, and number two, it creates the conditions for the body to begin to heal what's going on in the knees. That is, first and foremost, the most important thing you need to do is create comfort. The body knows what to do from there. So, that is my take, my feedback on how I believe the Queen can get out of chronic knee pain and get back to enjoying her horse riding. Now, if you're watching this video and you know the Queen personally, feel free to forward this email to her. I'd be more than happy to speak with her. And I do believe that her experience of knee pain is really probably only a month or two away to being completely out of pain. So thank you so much, and I'll be in touch soon.